Let's talk about the economy and what the vaccines will do for the economy. We know that we've kicked off our vaccination program from the 16th of this month, Saturday onwards, and with some trepidation still coming in from people. On day one, instead of 300,000 people, that's 3 lakh people, 2,24,000 turned up. So 1/3 didn't turn up over the first couple of days, but in all, we have till now vaccinated nearly 4 lakh people. That's more than 3.81 lakh people. 580 people have complained of adverse effects and 2 deaths were reported, one from Uttar Pradesh and one from Karnataka. The Health Ministry today in a briefing said that both those deaths were due to heart ailments not related to vaccination. Even though the questions right now are many. Will there be more and more people who come forward to vaccinate? Because remember, it's a voluntary drive at the end of the day. And how crucial it is from the economic point of view. We've been chugging along, we've seen some recovery, but to truly hit the next trajectory, we need a boost that the vaccine can provide. And to what extent can that incentive be provided? To speak on this, I'm joined today by Dr. Ramanan Laxminarayan, Director at CDDEP, Madan Sabnavis, Chief Economist at Ratings, on the show this evening, as is Siddhartha Sanyal, Chief Economist of Bandhan Bank. Welcome to all of you and thank you for speaking with us. Dr. Ramanan, let me begin with you and just let's talk about how crucial vaccination is to boost the economy and the recovery. Will it be more of a placebo effect in terms of boosting sentiment, because it will be some time before a sizable population is actually vaccinated with both shots?
Yeah, Tamanna, what we've seen in the last few months is that cases have been declining. Unclear why, we can only hypothesize. And the hypothesis has been that lots of people have already been infected, and there's some sense of herd immunity, at least in pockets, developing. What the vaccine does is makes that acquisition of immunity solid. Getting it just through the infection is not as reliable as getting it through the vaccine. And the fact that the vaccine is at least here and 400,000 people have gotten it means that at least it is within reach of people, even if not tomorrow, day after, at least within the foreseeable future. They might not know if it's May or June or December, depending on what their risk category is. But I certainly think that that people have a sense that the end is near, which is not something that they could have really believed until the first person was actually vaccinated, and now they're seeing the heads of all the science agencies and frontline responders all getting vaccinated. I think that boosts confidence a great deal.
I think that's a very important point, that top doctors stepped up to roll up their sleeves on day one, and we've covered that on the channel as well extensively, which will hopefully put in more faith. But it will still be some time before people come forward voluntarily. Madan Sabnavis, does that really matter, the number of people who actually get vaccinated, or will this sort of have a spillover effect of optimism in that sense? So, for example, restaurants will see more footfalls, malls and shopping centers will see more footfalls, maybe airlines will see more seats filled up, because there is a sense, like Dr. Ramanan said, that the end is near.
No, I would tend to agree with Dr. Ramanan, and I think having everybody vaccinated is a necessary condition before we get back to normal. Because as long as people are not vaccinated, there's always a fear that there could be an infection which we could acquire and we could also spread. And to that extent, I think opening up of the economy will be a little more challenging. So hypothetically, in case we talk of all the 1,300 million people being vaccinated, I think it will be very good times for the country or for any particular economy, because then we can move around our daily business as what we were doing before the lockdown was really imposed. So both from the point of view of health as well as from the point of view of the economy, because even for the economy, we have seen that sectors where there is more social interaction have tended to be more closed as of today compared to those where there is possibility of social distancing. So I think we can get back to normal only in case people are vaccinated, because relying on herd immunity would mean being a bit too optimistic, and we could probably also risk the possibility of a reinfection or something happening once again, which we would not like to happen.
Siddhartha Sanyal, let's look at the curveballs that may be thrown towards us. One is a slower pace of supply than has been anticipated in terms of the number of vaccine doses we produce versus the number of people that need to be vaccinated. The other could be a vaccine process that does not roll out smoothly, because remember, each person has to get 2 shots. The third, of course, would be new mutations and variations cropping up to spoil the party. Are these very real concerns right now?
They are. You cannot ignore these possibilities, because in a country like ours, where you have to actually reach the hinterland and all, logistics, preserving at the right temperature, right way, all these things can be real issues. Thankfully, what Dr. Ramanan said in the beginning, it looks like the infection at this moment seem to be coming down a bit. And with this vaccination, if I keep aside for the time being all these concerns, which are very valid concerns though, which you flagged, I'm seeing it from a very, very different angle. That if you actually over the course of the next few months actually be able to vaccinate a sizable population, it's a huge benefit, much more than many other countries in case of India. Because at this juncture, what we are seeing that agriculture and industrial activities and construction is limping back to some kind of normalcy. But as we all know, in case of India, India's activity is much more service sector oriented. And if in a lot of cases, you actually need physical proximity. So if you actually in a position to vaccinate a sizable quantum of people over the course of the next 2-3 months, maybe the uptick from the services economy, which is so very crucial in the Indian context, might actually provide a very, very strong tailwind for the Indian economy. So I'm actually focusing a lot more on that.
You talk about the service sector. Madan Sabnavis, let me come to you on this. A question has been raised that does the service sector, or will the service sector have the same extent of pent-up demand that we saw in the manufacturing sector? Because remember what started happening July, August onwards, I would say August onwards, when the manufacturing sector also rebounded because of some extent of pent-up demand. Do you think that service sector will have that same extent of pent-up demand? I mean, if you haven't, say, been on a holiday for the last 10 months, you will go just that one time. For example, do you see that pent-up demand will add up?
No, I think that's a good question, Tamanna, and because the pent-up demand story doesn't really play out when we're talking of services. Merely because I cannot go to a restaurant and have a meal doesn't mean I'm going to have multiple meals right now. The same thing holds for holidays. And we should also remember that when you're looking at services sector, as what we all know very well, that there have been a lot of trends which have really changed. Like going to a cinema theater and rather watching things on Netflix or any of these other channels has actually already created a dent for this particular industry. So what we'll actually have done is a lot of lost space will be regained by some of these sectors, but it'll be a case of starting afresh. We definitely will not be seeing a case of pent-up demand. So what is lost is actually lost. So I would say that's a kind of a permanent damage which has taken place to the economy in the services segment.
Dr. Ramanan, let's talk about the timelines by when we will see a real change. Now, Fitch, for example, sees global recovery really come limping back by mid of 2021 due to vaccinations. Would there be a similar timeline in India? On Saturday, I was speaking to experts about the vaccination drive, and one of them told me that he expects, say, your 60 million people required for a herd immunity impact to be vaccinated in the next 18 to 24 months. So that's still 2 years away. What are the kind of timelines you see for the economic benefits to start kicking in?
Tamanna, you don't need to get to herd immunity for the economic benefits to kick in. First and foremost, the vaccine reduces any individual's risk, increases their confidence, and makes it more likely that they will step out and be active participants in the economy. That is fundamentally what COVID has done, which is just prevented people from going out and doing things or buying things which they otherwise would have done. So I don't think you have to get to herd immunity to see the recovery. I think it's really in the mind. If people feel that things are coming back, they're going to start behaving that way. A few people get vaccinated in their families. Perhaps, remember, a lot of people in the under 60 age group are being extra careful because of elderly parents who might live in the household who are above that age. Once that group gets vaccinated, I don't think the rest of the population is going to worry as much. They're going to come back in full force. So I think there will sort of at least be a pent-up, demand and spending, however it might be, that will be unleashed because people have been, constrained for long periods of time. But I don't think that's a 2-year process. I hope and think we will see that in the next few months, particularly because I think you will see India's vaccination rollout will be much faster, even as a proportion of population, than in many developed countries.
I just want to bring up another interesting question. We were speaking with Swaminathan Iyer on the channel today, and just a programming reminder, we'll play out an excerpt of that interview for you later in the show. And he made a point that vaccines should actually be given free to chug along the economic recovery. Dr. Ramanan, what do you make of that proposition?
It makes perfect sense. It's something which is just a sheer, confidence investment, so that even people who are constrained from getting the vaccine for whatever reason, do get it. But I think in India, there's a large proportion that will get it regardless of the price. And there's no reason for the government to subsidize that bunch. I think the government should just be prudent, and someone who's, the bottom median of the population should probably get the vaccine for free, because even at the price point at which it would be sold, it would be unaffordable. But I think the plan is, to get it out to as many of those folks as possible at this point in time.
The other piece of the puzzle, perhaps, and Madan Sabnavis, let me come to you on this, is about the private sector getting its hands on the vaccine and large companies getting their hands on the vaccine. Those efforts are on, as is being reported, to tie up with vaccine manufacturers and see how they could very quickly perhaps get their employees back into office by vaccinating a fair amount of them. Would that really speed things along?
No, absolutely, it will, because if we actually look at the organized sector, we're talking of a total employment force of something in the region of around 20 to 30 million people. So just assume that my company says that my entire family can be vaccinated. Either the company bears the cost or we bear our own cost. So multiplied by 4, we're actually talking of something like 80 to 120 million of the population could be independently vaccinated, and we could really steady up the process. So we need to have both the engines firing. I do agree that it may not be the government may not be in a position to finance the entire thing, because again, just look at it. 400 rupees per person into 1,300 million means 52,000 crores. I don't think the government has that kind of money, nor is it willing to do it. So while the idea of giving free vaccines to everybody is commendable, but I don't think it's practical. So the private sector will have to play a role, and lots of people like you and I will be willing to pay for it, but we should be given access to it as soon as possible, which will be possible only in case you open it up to the general public.
The question really is, and Mr. Shukla, Mr. Sanyal, I'd like to also have your view on the free COVID vaccine point, as well as how we will actually see, what's the nuts and bolts of seeing the impact on economic recovery?
In terms of we'll just like to touch upon the other question you asked, that it not necessarily be the government or the central government alone who might have to take the entire burden. There can be a role of the private sector as well, where actually some of the large private corporate sector can also step in and actually can try to help people in their immediate ecosystem, etc. And maybe we need to provide some bit of help, some bit of momentum through the CSR rules, etc. All these things are possible. But I think rather than depending only on the government, possibly some more people joining hands is more practical and more feasible, exactly like the way Madan mentioned. And in terms of what we might get to see, I think at this moment, a huge deterrent for the economy as a whole is a lagging consumer confidence. And once we have the vaccine in place, if we actually can immune people from the fear that you might not get impacted immediately, or your immediate family members might not get, you are not being acting as a risk to your family members, the normal economic activity can actually come back much faster than what was anticipated maybe just a few weeks earlier. As it is, we get to see with some bit of softening, looks like there is a bit of softening in the infection levels, and activity on ground is seen to be coming back with a little faster, especially on the bottom end of the pyramid. We are seeing activity coming back a little faster than what was the case a few months back. So these are all very, very positive and healthy signs. We just hope the vaccine actually makes this entire process a bit faster, and there is every reason to believe that it can actually achieve so, even though the overall covering the entire population, etc., might take several quarters. We might see the significant difference in a quarter or two.
You know, that's interesting. In a quarter or two, Professor Ramanan, there's a bit of a catch-22 here, because the idea is that a widespread vaccination rollout will tell people that the pandemic and its impact has ended. They can go about to life as normal. But on the other hand, all the medical experts say that even after the vaccine, you have to mask up and maintain social distancing. That will happen through most of 2021. Will that not be a conflicting sort of thought?
You know, that's a good point. And I think we should reiterate that people should continue to mask, just to prevent them passing on the infection to someone else, even if they've been vaccinated. Because we have to remember that the first set of vaccines that we are getting right now do not prevent transmission. They only prevent you from getting the infection. They don't prevent transmission, right? So you can still be a transmitter of the virus even without necessarily being infected by the virus. So if we keep that in mind and we continue these behaviors, there is still certainly going to be a point in time, maybe I would say, towards the end of the year, where a lot of restrictions just get lifted simply because the caseload has dropped to a point where it isn't really a serious infectious disease threat. You have to remember, we put in place an unthinkable act, which is to put a lockdown in place nationwide to curtail this epidemic. And even then, it has been, so bad for the country. So I think that, we've already crossed that tough part. And now people will just see, listen, it's come down a fair bit. And therefore, I think the confidence to return to economic activity will be there even if people are wearing masks. I think people may wear masks as a courtesy and a concern, but not out of a sense of fear, which is also what's driving mask wearing now.
Mr. Sanyal, do you see as a problem the kind of doubts people still seem to have about vaccination and vaccinating rollout, that we will wait and watch? We'll first see what's happening, how many adverse events there are, if these vaccines seem to be working, and then we'll go ahead and take the vaccine. Do you think that fear will sort of play out as a barrier to quicker and more even vaccination rollout program?
Very good point, Tamanna, and you cannot rule out that possibility. But the positive side here is, while this can be the case on the first day, on the second day, on the first week, on the second week, soon these fears, unless we see some adverse developments at a large number, this kind of fears can start disappearing very, very quickly. So my sense is that while you might have seen that 1/3 of the population, as you mentioned, didn't appear for the vaccination on the first day, this number and proportion might actually be a significantly lower number, just maybe in 10 days' time, and a significant improvement you might see in the next 10 days and the subsequent 10 days. So possibly that particular curve is an exponentially falling curve rather than some kind of a slowly downward sloping curve in terms of people who are missing out on their scheduled vaccination and all. So in sum, while you might see that phenomenon to persist for the very initial days, without any adverse development, that particular number might actually turn out to be very insignificant pretty soon.
Absolutely. I think as more and more confidence starts being regained, and as people will actually see the proof really of widespread vaccination, fewer people with any adverse events or adverse effects at all, maybe more vaccines in the market as well, then things will be a game changer. Possibly 6 months down the line, it won't be a big deal at all to have got the COVID-19 vaccine. It'll be very matter of fact. Well, let's hope so. And thank you so much to all of you for joining us on The Big Story this evening. We're tracking the vaccination program very closely on ET Now.